Good morning, everyone. My name is Tanisha Clark, and I am a clinician in the Population Health Collaborative Care Program. Thanks for joining Rounds this morning. We have a great speaker. Her name is Dr. Helen Sue, and she works at Stanford. Dr. Sue is a lead outreach clinician and lecturer at Stanford University, where she is the liaison to the Asian American Activity Center. Dr. Sue has been a director of clinical training, supervising psychology and counseling students since 2003. Prior to shifting into college counseling, Dr. Sue was a clinical supervisor of services in K-12 public schools, specializing in bilingual and bicultural families, and in community mental health agencies, serving those with chronic and persistent mental illness and geriatric services. Dr. Sue began her clinical supervision and program coordination career at Asian Community Mental Health Services in Oakland, California, where she had first interned as a bilingual clinician. Dr. Sue is Mandarin speaking. She is the past president and fellow of the Asian American Psychological Association, and she is the chair of the American Psychological Association Minority Fellowship Program Training Advisory Committee. Additionally, Dr. Sue was an advisor for the Netflix show 13 Reasons Why and has presented nationwide on topics relevant to youth, young adult, and Asian American mental health, and has authored several academic book chapters. Her current work includes college mental health outreach and counseling, improving access to culturally responsive psychological care for diverse communities, mentoring future leaders in multicultural mental health, and providing grief support. So now that you know all of her wonderful qualifications, I would like to welcome Dr. Helen Sue to Rounds. Good morning, Helen.
Great. Good morning, Tanisha. And hello, everyone. Thank you so much for being here. I'm absolutely thrilled to be able to present with you today. I always start with the caveat too. Thank you for being here. And even when I was serving as president, I'm past president of the Asian American Psychological Association, that I do not represent all Asian Americans. None of us can. So it's always a funny thing to be considered an expert in this, but I do my best to present the basics and acknowledge sort of the limited perspective that I have as an East Asian Chinese Mongolian person with ancestry, but born in Taiwan and immigrated to San Francisco before I was 4. But excited to have a chance to talk about Asian American resilience in the pandemic era. I think there's plenty of discussion right now about the rise in anti-Asian harassment and hate crimes, and that's definitely a concern. And I also want to look at how do we just improve our services and promote resilience in such a challenging time for all. Objectives to really identify what are the key bimodal demographic and historical facts that are really relevant to AAPI mental health. How do we assess the systemic factors? I know you all have been doing great work examining social determinants of health, and how is this particularly impacted in the COVID-19 era? And really understanding clinical approaches that integrate cultural and community resources that are relevant to AAPI resilience as we think about treatment considerations. And really quick, who are Asian Americans? That's always a bit of confusion. People tend to think of East Asians like myself, but we're so much more than that. First of all, just understanding that Asian is a global majority, that's an important context, as most of us, including myself, are trained in a very Western-centered place. If you go back, there's a National Geographic article where they posed a photo of the most typical human on Earth right now is a 28-year-old Han Chinese man. So the photo is, this is the face of 7 billion. That is the most typical person on Earth. By 2030, that will be a youngish Indian man. But within the United States, we're talking about 22.6 million people and growing. More than 30 countries of origin, and many of us, besides speaking different languages and having different spirituality, we're even literally at war with each other, sometimes in our home countries. So to become one group here, Asian American was really actually a political identity. The term is largely credited to have begun locally in Berkeley and San Francisco. as all of us heterogeneous Asians came here and realized that we are treated the same, we have some values the same, that Asian American is actually a thing that exists only in the United States. We are the fastest growing ethnic group and actually projected to surpass Latinx Hispanic communities by 2055. And we rarely talk about 13% of the 11.1 million undocumented immigrants within the US are actually Asian Americans or Asian heritage. Maybe the most important thing to keep in mind is that in the United States, we are approximately 6% of the total population, and that 6 groups make up most of us. So that's why usually when you think of Asian Americans, people will tend to think of Chinese, Japanese, Korean, often leaving out that actually Filipino Americans have been here since the 1800s, and Indian, South Asians, and Vietnamese are also some of the largest communities. Certainly in the Bay Area, we see a lot of all of these groups and many more. The key thing to start any assessment too is just how does your client self-identify? You'll see me use, and it may seem confusing, a lot of different terms like Asian American, AAPI, APIDA, AANHPI. So that's really something you want to ask whoever you're working with. Do they actually see themselves as Asian American? For example, my parents would not identify as that, though they lived in the United States more than 40 years. Are they an immigrant, or are they like a 5th generation born American? International students, for example, Stanford has a ginormous international student population, and they have very particular stressors, especially in these last few years. Are they any adoptee? Are they a transracial adoptee? That community is creating more literature about their own needs and experiences. Third culture kids may be something you're starting to hear about. And that refers to people who were raised in a third culture. Perhaps say their family is from India, but they actually spent a significant amount of time growing up in, say, Brazil, and then now they're here in the US, and they actually have much more than just the bicultural experience. Asian American Pacific Islanders, you'll see AAPI a lot, or Native Hawaiian Pacific Islanders, and really asking again, how does someone self-identify, where do they belong? For example, at Stanford, our Native Hawaiian Pacific Islander communities tend to feel more close affiliation with our Native American Community Center than they do with the Asian American Activity Center. And so really allowing people to find their place and where they intersect, right? Or we have a Muslim campus center. And so we have students who are in multiple centers. APIDA, Asian Pacific Islander Desi Americans, recognizing South Asians, Desis, as a large and sizable community, or are they multiple heritages? So these are photos, you know, of Evan Lowe's local congressperson at the Division on South Asians within AAPA Pacific Islanders and Alameda County Behavioral Health. Alice Wong, local disability activist, 2 of our past presidents of AAPA, and of course, our newest Disney princess. But being clear on how someone self-identifies, because phenotype is such a difficult thing to judge and very misleading. Okay. And very important is to understand this, you know, that APIs are not a model minority. And in fact, the lack of data disaggregation is a major factor in just our significant lack of understanding about these communities. That, as you can imagine, when you have an extremely bimodal curve of data, what happens when you smush that curve together and we lump us all together? Well, it looks like a normal curve distribution, but it's not. By bimodal, I mean we have some communities with the absolute highest range of income levels, far above, say, the average US annual household income, but we also have communities at the very lowest end. The most recent arrivals, refugees, communities. And so we have a bimodal distribution in things like income level, health access, and educational levels. So the graphs here just show, for example, the differences within our community are pretty dramatic when you look at, say, your average Burmese American household income compared to your average Indian American. why do we know so little about AAPIs? Even myself being trained here, that there's very few of us who ever had niche coursework, despite the incredible heterogeneity of the community, and despite working in places like the Bay Area where there is such a huge amount of the population we serve. Now, I'd mentioned earlier that we're about 6% of the US population. And I like to ask my classes, well, guess how much NIH funding we get to actually research these communities? And I get guesses like 3%, maybe. But we know very little, and the data is not disaggregated properly because we're talking about funding that is below 0.2%. So 0.17% of the funding is actually dedicated to all of these groups together, despite their many disparities. So that's kind of the origin of why we actually know very little. But bringing us back to where we are now, APIDA mental health care in the time of COVID-19, right? That we are coming from a foundation with less than 0.2% of research funds. We have a psychological science and educational system primarily based on quite a small privileged education, right? The weird population is where most of our literature is. Weird, Western educated, industrial, rich, democratic. Does not describe where many of our clients actually come from. And there's a lot of great work being done about how do we actually reclaim narratives? How do we integrate mind-body health practices that are appropriated, frankly, from ancient and indigenous communities? That a lot of what we are recommending for clients, their grounding exercises, their meditation or yoga, these have existed in a lot of ancient cultures for thousands of years, literally. And how do we integrate this in a respectful way? And how are we providing mental health care to such a heterogeneous bimodal population who may also suffer from internalized racism, the traumas of imperialism and colonialism, migrations, separations from their own ancestry and spirituality? It's a tall order. And our current situation, right? There's a lot of alarm, rightly so, about the rise in anti-Asian violence. It has started escalating quite noticeably last year with a lot of the COVID-19 news coinciding with a lot of scapegoating and political slurs. But it is not actually new in US history. And that's an important thing to understand, that this whole idea of a yellow peril and associating immigrant communities with disease has been around since the 1800s. And we're often never taught that there have been lynchings of Chinese Americans, attacks on Filipino labor camps throughout United States history. So the LA massacre, there is a plaque actually in front of the Chinese American Historical Museum in LA. Asian Americans were subject to still the only legislation that exclusively targeted an ethnic group, the Chinese Exclusion Act, that was also later extended to actually ban immigration, right? And of course, we're all familiar with Executive Order 9066, interning Japanese American citizens and their families in very poor and difficult conditions, even as some of their children were fighting on behalf of the US military and were the most highly decorated unit of the war. And there are many instances of losses. The murder of Vincent Chin was a hugely galvanizing, politically galvanizing event in the 80s. There's the murder of Joseph Ileto by a white supremacist who also went to shoot up a Jewish community center. The Oak Creek, Wisconsin attack, where also white supremacists just entered a place of worship. And more recently, Srinivas Kuchibotla, who was murdered in Kansas. And all of this history brings us to the pandemic scapegoating, the slurs, the current escalation in anti-Asian attacks. Of course, all these things are always linked with other social issues such as economic strife, right? And so we are in a place where we have a perfect storm of economic strife, as well as disease, as well as poor political leadership. So, for example, you could look up, we created a anti-Asian harassment website with some history and resources. I think we made it last spring when the scapegoating and the slurs were already coming out, and we could see the writing on the wall of what was going to be coming down the pike. And so this is a context that a lot of communities are really struggling with right now. I think a lot of our young people, for example, don't recall like the murder of Vincent Chin. And one of the reasons it was significant was that he was murdered. He was mistaken for being a Japanese American who was being blamed for losing auto jobs. He was Chinese American, but also that there was absolutely no justice involved. No one ever went to prison. The fine was something like $3,000. So that was a very significant event in understanding the lack of standing APIs felt in the United States and the lack of safety. Okay. And also, what is the impact of just COVID alone on AAPIs? That there's some really amazing data. So AAPI data in general has fantastic resources. This is from 2020. That overall in the US, the percentage of average deaths for Asian Americans has gone up 35% more than in a normal period of time. In areas like New York and New Jersey, that number was more than 100% more loss. So we're also dealing with a huge amount of loss in the community from illness. And certain groups, like people, as we know, in multi-generational households have faced extra stressors and losses, as well as healthcare workers. So the Filipino American community, for example, has borne an undue burden in that area of loss. So microaggressions, 2 hate crimes that Stop AAPI Hate was started, I believe, March last year. And within 3 months, had 1,400 reports. The attacks are 2 to 3 times more likely for women. So again, our intersectional identities, reports from at least 46 states. I think that may be up now. But without even getting to the blatant sort of hate crimes and harassment we're dealing with now, there is a great body of work about microaggressions, specifically those related to model minority stereotype, the constant foreignness microaggressions, right? You could be a 5th generation American and people are still telling you to go back to your country. And that all of these have been shown in the literature to be associated with poor self-rated health status, mental and physical. And that like other microaggressions and racial stress for other BIPOC people, the microaggressions have to be taken seriously as a social determinant of Asian health. That these kind of constant stressors do take a toll on mental and physical health. So this one is from 2019, and it's quite striking that in the Pew survey, asking, have you ever personally experienced discrimination or been treated unfairly because of your race or ethnicity? And as of 2019, the rates are quite high, and strikingly so. So it's a stark contrast to this idea that in some ways APIs are seen as white adjacent and not dealing with any problems of racism or discrimination. So where are we at now? We have a very difficult situation where APIs are feeling very hyper visible and targeted and blamed for the coronavirus, while also still being pretty invisible from local public health, from funding, and from tracking. So this invisibility. There's a lot of great interviews and public forums right now addressing anti-Asian harassment and hate. For example, my colleague, Dr. Sherry Wang at Santa Clara University has a lot of interviews and research out, and people talk about the invisibility or the silence of our allies has actually felt very painful as well, in the face of the scapegoating and the violence. And what is it like when APIs seek behavioral health care? I have for years collected quotes from people who've gotten bad care. It's a learning thing that I think as therapists we have to constantly think about. How does our field, how successful and effective are we in treating APIs? Some quotes I've had: when I was a teen, I hated the first private inpatient place. I wanted to see my regular doctor and therapist. Staff threatened my immigrant mom that if she took me out of there, CPS would remove me. Not true. My own psychiatrist gaslit me about the hate crime I experienced. My East Asian therapist totally invalidated that there's colorism in Asian families. My family has hurt me with body shaming and colorism my whole life, right? So within group, we also have lots of space for learning and lots of history. My dilemma: feeling torn between anger at my in-laws, but wanting my kids and husband to have a strong family relationship. My white therapist cut me off mid-sentence. She said I had to grow up and stop being enmeshed, right? And so we do a lot of great work, I think, in our field to encourage help seeking, because APIs have very low help seeking rates. That is well known in the literature. And yet, if they have these extremely invalidating experiences in behavioral health care, we are actually perpetuating harm. However, therapist match is not essential. I do put an asterisk there. Some small communities will actually prefer a non-adjacent healthcare team. I've worked with a lot of people in very small communities, say Cambodian American communities, Afghani American in Fremont. We have the largest Afghan community in the United States. It's such a small community, they may actually feel a lot better and safer with someone who's not from the community. And there's a real positive impact, potentially, of validation and aid from others with privilege. And how do we use our privileges? But how do we make it effective when there's not a cultural match or a net match, right? We use cultural brokering. What does that mean? Do we have cultural brokers to help us do psychoeducation, to do translation, to really carefully explain what to expect from behavioral health? Providing multiple modes of feedback planning. Very often in places I've worked, I've had to make it clear that culturally, for example, a lot of AAPI clients are not going to give you direct verbal feedback that they didn't like something you said, because you're the authority, right? So are there multiple modes? Can we follow up besides asking directly in session? Are there written things? Are there anonymous things? Different ways. And really being thorough with our clinician ongoing self-assessment, and extremely careful with the psychosocial client and family assessment, given the extraordinarily complicated histories of our clients, and really looking at it multi-generationally. That APIs tend to be communities that do practice, for example, like passing on ancestor stories, keeping altars. How does our intergenerational resilience and survival or intergenerational traumas really impact the here and now? And so for the asterisks, I don't need to educate this crowd, I think, on cultural humility, but that is absolutely fundamental to doing this work. That therapists, to be aware of their personal biases, they have to possess sophisticated and ongoing metacognitive abilities to monitor their cultural assumptions, values, and biases. So having a team that you can actually consult with, continuing our own education, identify goals all the time. As I've evolved, for example, although Taiwan is to me my home, I don't refer to myself as Taiwanese American anymore out of respect for the indigenous peoples of Taiwan. Or I've identified now that ableism is sort of the area that I need to grow the most. And so constantly checking about how do we grow to do the best work. But that therapist match isn't essential. It's not possible either or available. And in the brief time we have, I wanted to introduce some of the people who are doing resilient and innovative work. How do we integrate ancient healing in modern times? This photo is staff from Filipino Mental Health Initiative presenting at the Division on Filipino American Conference. And they talked about using social media and drumming circles to support communities living with chronic and severe mental illness. So a lot of the work is community-based. Now, having trained for about 20 years in community-based agencies, I always feel that that's a very effective medium. But for a collectivist culture, which is the majority of the world, but very heavily in AAPI communities, it's absolutely essential. Thinking about how do we do interventions that are community-based, familial, creative, right? Many cultures do not articulate and sit around talking about their emotions a lot. It's just not the practice. Spiritual, integrated, holistic, being raised with mind-body assumptions of health. And sometimes integrating the vocational, what is practical, can also be very healing. And so, for example, how does this look? There's some research, for example, on familial coming out, that the coming out story for, say, queer youth that is often portrayed in Western culture in a lot of Asian families, it's actually a family coming out process. And that there's sort of growing research into what that looks like as opposed to the individual story. Right? And as we think about implementing evidence-based treatments, we have to look at where does the evidence come from? Because for most of our communities, the evidence was not ever, the research was never done in our communities. And unfortunately, some of the agencies that we may all be working with that are doing amazing work really have not been able to write up the work. So for example, at Asian Community Mental Health Services in Oakland, they had a grant to implement an evidence-based family treatment model. Really great study, careful controls, regular consults with the advisors, thorough training. And they really found that the model did not work well at all for our Southeast Asian refugee families. And yet all that work was never written up because community-based agencies lack the funding and the time, right? So where is the evidence coming from? Do we have it? And always when we look at our EBT, right, we're examining how it worked in the experimental research condition, how it worked in practice, but is it effective for this client before me? So kind of going down the levels there. And some of the photos here. So with a lot of our survivors, highly traumatized communities, the Healing Garden was actually one of the most well-received activities to gather people and then do group processing. Martial arts or movement therapies. That photo is actually my dad, who's been a martial arts practitioner his whole life. But for example, Alameda County had innovation grants, and one of them was elder Qigong practice that had brought elders, Asian elders, to the Oakland Community Center to practice Qigong, movement-based health activity. And there they would do mental health screenings and education. But if you'd ever asked them to just come do mental health screening or education, they would have never shown up. So how do we integrate these into our work? And the other is from the Art is Healing Art Show, also from Asian Community Mental Health Services. And really thinking about what my mentor had always talked about, community-based evidence, right? That community professionals are addressing the gaps in current research methodologies. And there are many current research and intervention projects on the impacts of COVID-19, as well as anti-Asian violence, as well as the economic strife of this time. So we're learning quite a bit. There's a lot of great work going on. And, you know, psychiatry, there's also work going on, again, from within the field about actually understanding, you know, ethnopsychopharmacology, right? Really understanding the pharmacokinetic, pharmacodynamic profiles that are different for how our bodies react to meds that were also tested and normed, not on us. Really understanding the issues in psychiatry, and great work going on at Semel and UCLA. And then that's Dr. Rona Hu and several others from Stanford Psychiatry, that they've actually been, for example, going out into the community. She's wearing an apron because they were role playing how to talk to youth, because in response to the very tragic Palo Alto suicide some years back, that they really realized psychiatry needs to get out of the office and really do more prevention and work with the parents and the families and tailor these trainings for Asian American parents. A lot of them which said, we don't know how to talk about these issues. So how do we grow psychiatry to best serve the needs on multiple levels, right? And of course, best practices, that stakeholders have to be a central part of interventions, program planning, assessments. This is the group from Mission San Jose High School in Fremont, that they won an Alameda County Behavioral Health Award for their work on peer education for mental health. That the resilience really is coming from within our communities now. All of you who do work with iGen or Gen Z are aware that this is a generation that is extremely aware and more open to talk about mental health issues, stigma, being proactive about care. And at the time they won this award, they were the only Asian people in the room at the County Behavioral Health Care Awards, and certainly the only young people. But I see a lot of great leadership coming up ahead. Within Asian American Psychological Association, the majority of our members, I think at this point more than 900, are graduate students, so future professionals, educators, and researchers. And I'm very excited to see what they will be able to also innovate, although they'll need a lot more than 0.2% of the NIH funding. And what do we suggest? Of course, accomplices are better than allies. As Dr. Bettina Love has spoken very well about, what is that difference? To be an accomplice actually means you have some skin in the game, some loss or difficulty, right? So it's standing up even when there is challenge and things get hard, and planning to work together. So I believe many of you, if you were there when Dr. Lamanda Hill was visiting, Dr. Hill and I bringing in decolonizing work to Stanford is some of our accomplice work. We really recommend that as you do work with diverse communities, right, really building your resource list ahead of time. Cultivating that network of allies and accomplices. Like this first picture here is from the Council of National Associations for the Advancement of Ethnic Minority Psych Associations. So the unexpected best part of my experience, I feel, being involved with the Asian American Psych Association, was developing relationships with the Association of Black Psychologists, Society of Indian Psychologists, the National Latinx Psych Association, and our newest, the Association of Middle Eastern North African Psychologists. But build those before you need them, right? We get a lot of desperate last-minute emails like, please, can you help us with this or consult on this? And it's a lot more difficult when we don't know who you are and we have not had a relationship, and there may not be trust. Community must always be present and known among policymakers. I feel that's a part that AAPIs have been lacking. And unfortunately, it seems when we've had tragedy is when we become more activated and involved. So in the 60s, that was the Third World Liberation Alliance that helped develop ethnic studies in San Francisco. Then maybe we got a little complacent. In the 80s, it was the murder of Vincent Chin and the lack of justice that galvanized an entire generation of AAPI activists and community leaders. And unfortunately, I think the current spate of terrible violence is activating us again. I wish it could be done without so much losses, but the use of documentaries, storytelling is very culturally congruent and helpful. This generation is mastering the art of social media to organize and educate. A lot of mental health education going on in social media. I know we all have probably mixed feelings about that in terms of quality, but it is a way that people who may never come to our offices are getting some important information. So important to always do full inclusion of our consumers, our youth. Workforce development is key. We just are always in need of more culturally skilled, linguistically skilled people with lived experience to do this work. And accessibility, I know there's a lot of room for improvement there. As my friend Dr. Cheryl Wu, who teaches at Gallaudet, has talked about, she's constantly feeling and working with people who feel like there's things for perhaps, say, the hearing impaired community, there's resources and supports for the AAPI community, but how well do we actually integrate accessibility into all of our spaces? Right, community-based investments, that there have been agencies doing amazing work for decades. And so while there's a sudden alarm and a sudden increase in attention and funds wanting to address the current violence, like how do we really invest in ways that are sustainable? Another thing about Gen Z, I suppose, or iGen, is that they are resisting anti-Blackness in their anti-harassment and anti-hate crime work in a way that I don't feel previous generations necessarily did quite as successfully. So really working again on those alliances with other communities and organizations. There's bystander intervention trainings being held ongoing right now from Hollaback. You can look up those online. I think we were doing some of that some years ago, right, as trying to respond to the great rise in anti-Muslim sentiment and crimes. And so it's sort of, this is a training that's beneficial for the protection of all in community, is the bystander, upstander trainings. And so community-based investment, right, that it was a multiracial group of locals who've actually, for example, in Oakland, they started an escort and translation and just assistance program for elders in Oakland, and that it is throughout the community, and at this point has like 700 volunteers. So thinking about strength-based and constructive and sustainable ways to actually address the issues we face. And integrating spiritual care, that this can be done well in a way that can be a win-win. If you have not already, read about, I'd really recommend looking into, in Merced, for example, they've actually found a way to integrate Hmong shamans as part of hospital care, and mutually beneficial program there, right? That they help the shamans learn about certain things about how the hospital works, procedures, why they do what they're doing. And the shamans also provide a certain number of spiritual ceremonies that the patients are requesting, and it increases trust and engagement and follow-up with the hospital as well. Faith-based community efforts are hugely important. So, for example, training pastors about domestic violence awareness. I think that this, for many communities, a faith-based leader is perhaps the first place they'll go when they're in distress or to seek support. And so really thinking about how do we integrate spiritual care and consultation. And resiliency is also about policy and organizing long-term, right? Again, to look at examples of work, there's a National Council of Asian Pacific Americans, which is, I think at this point, 37 different agencies covering everything from labor to health to mental health to culture. But they are based in DC and really advocate for policy changes, right? It's like, how do we start getting the funding or getting the representation to protect safety, protect health? Professional associations. For a lot of our up and coming professionals who don't live in a place like the Bay Area, it can be extremely isolating and difficult. And so professional national associations can bring people into the mentoring and the networking that they may not get at their home institution. Civic involvement at all levels, everything from your local county behavioral health care to city government to state, national. And I just put the Congressional Tri-Caucus +2 as just an example of thinking large scale, that the Congressional Tri-Caucus, if you're not aware, is the caucus there is a Black Congressional Caucus, a Hispanic Latino one, as well as an Asian caucus. And then the +2 are 2 Indigenous Congress people. And so that they've worked together. And a perfect example is that when Representative Bass had ideas and potential funds to do research about the impact of COVID on the health and well-being, specifically of minoritized, marginalized communities, and brought that to somebody, a past president of ABPSI, Association of Black Psychologists, they actually also sought us out. AAPA, NLPA, SIP, and so that's like something that's happening very real on every level now, from the congressional level down to sort of the grassroots research. So it's a perfect example of how this actually plays out in the daily lives. But that if you're not represented, you're always going to be sort of left out. So policy work is something that also I was never taught in my graduate program, and that I do try very hard now to put in the minds of our young professionals. And fundamentally, resilience and reclamation. Don't have time to get into the long history of many things, so I'm really curious to see, what types of interest and question we have. But as Yuri Kochiyama had said, consciousness is power, right? Consciousness is education, and knowledge is becoming aware. That a lot of marginalized communities are never taught actually a very important history. Right? Why were we not taught that? For example, Cesar Chavez and Larry Itliong finally had success with the Delano grape strike only when they worked together. That Wong Kim Ark had sued the United States government in the 1800s, and that case set a precedent for birthright citizenship, which impacts us to this very day, right? So there is a reclaiming of mental health, like space and place and belonging, that a lot of the young people I work with are actually coming in quite aware about, like, internalized racism, colonial mentality, really exploring where did they get these irrational thoughts and ideas. And it's a lot from what we're taught, but also what we're not taught. So in dealing with the extreme challenges of these times, grief, pandemic, economic loss, the rising hate, the stereotyping, right? On the short term, we need work just on grounding skills and safety. That's fundamental. The moderate term, right? Psychoeducation, coping skills. The long-term, slower work, really reclaiming history and place, developing community and advocacy. That this is all level of involvement that, again, was very missing from my extremely clinical training, but that now, in working with the community for so long, it seems it's very, very much integrated, can be done very successfully and beautifully. And I think it's where our future is as a field in terms of relevancy and innovation. Now, I have various resources listed that you can follow up on. There's a lot of groups creating tips, infographics that can be helpful for you. For example, this tips for families dealing with COVID-19 discrimination has been translated into multiple languages. Stanford Cheapow, if you look them up, they're the videos that do like parenting, dialogues. AAPA has divisions focused on students, on women, on practice, on LGBTQ, Filipino Americans, multiple heritage adoptees. So lots of great resources that no one has to sort of feel like you have to recreate the wheel, as well as national organizations. Each of their websites also list many more excellent handbooks. Stop API Hate has a youth handbook, which is excellent. I highly recommend checking that out. There's a coronavirus anxiety workbook, a great CBT workbook that's available for free and does have multiple languages, including Chinese and Korean. Okay. And I will kind of end there. I know I've covered a lot of range. Would love to have more time to get to questions. Let me stop sharing and we can talk a bit.
Great. Helen, that was so good. Like, I love how integrative and holistic it is. So much information. And I love the idea of having an accomplice. So, yes, a couple really good multi-layered questions. First, are you going to share these slides?
Yes, we'll be happy.
Okay. So these slides will be shared. I have a couple good, like there's some really sweet feedback to you that I'll send to you. The questions, how to distinguish between the psychiatric interventions you mentioned and race-based medicine. I want to make sure I'm understanding.
In psychiatry?
Yes.
Yes. As not a psychiatrist, it's not my specialty area, but there's a lot of great work you can look up. I know UCLA has been doing this a lot about how they're starting to understand that the medications do, physiologically interact differently with some populations. I think AAPIs have sort of anecdotally known this for, our whole lives, that a dosage normed on a 200-pound white man is really way too much for me, and so people have always been sort of messing with our own dosage, and it leads to the non-compliance and unhappiness or discontinuance of treatment. So I think ethnopsychopharmacology is really studying the interactions and the effects, and how do we make these treatments maybe like coming up with recommendations for dosing or education as well, and interactions. So not my specialty, but there is some really great work going on, and I know especially out of UCLA.
Okay, thank you. Next comment / question. Thank you, Dr. Sue, for this presentation. Really appreciate it. Part 1, what are your thoughts about how conversations around these Asian American themes today can be had without making it seem like one is decentering the salient issue of anti-Blackness and BLM? I'll start there.
Yeah.
Well, the difficult conversation around Asians is typically invisible in dialogues, but needs to be had, but without making it about either or.
It definitely is not either or, and I see a parallel, right? A lot of what I do in individual therapy is trying to get people away from like my bimodal black and white thinking. And like, most of life is like this gray, this modulation. Same thing for our larger issues. It's not as if, if we pay attention to the injustices and how important BLM is, that somehow takes away from Asian Americans, which I think, frankly, is how a lot of people take it. And to be honest, there's a great deal of dialogue and conflict within AAPI communities right now. We tend to have a lot of older AAPIs who are less English speaking, who feel that more police is the answer, and I think a lot of dialogue is a lot of addressing it. We had a great talk on Clubhouse, which I still have mixed feelings about, on Clubhouse last Sunday night with Dr. Tama, addressing like the ways that the model minority myth and has been pitted against Black and Brown communities. And it's important for us to understand that this is something that has served to split us and doesn't serve either of our communities. In Oakland, we found ourselves doing a lot of work, that there were Black communities that were very resentful about, why are these people like here? They're not friendly to us. Why are they this? And, kind of doing education on both parts, right? A lot of our refugee families that had moved to the area, they had gotten this idea of Black criminality from media, really, a lot of Western mainstream media. And the Black communities had not learned about how US history and imperialism has led to a lot of these refugees coming here. Our histories are much more intertwined than I think we've been led to believe, which is why I've come to really see, for example, how actually historical education is essential to healing. I was very heartened during the height of the Black Lives Matter protests last summer that a lot of young Asian Americans created a whole series of resources that are available online about how to talk to your Asian family about BLM. And it was community created and community translated into multiple languages, right? It's learning to see that our issues are very similar, that crimes are going up. Everyone is under extreme economic duress, and that's when these things happen the most. But how do we focus on what helps all communities, right? There was a very powerful dialogue on Sunday's conversation about, for example, Black and Korean communities and Korean Americans during the riots, and how ultimately they were all abandoned by the powers that be that went off to protect Beverly Hills and Brentwood. And how do we actually see these historical connections and work to better the situations for everybody, right? That both can be important, and all, because we have to hold it all right now. These are very complicated and painful times. BLM is not resolved. The anti-Asian violence is extremely alarming and heinous. We still have kids who don't have their parents at the border, and we still have a lot of anti-Muslim sentiment, right? And literally we're involved. Like, the man who murdered Srinivas in Kansas thought he was Muslim, right? A lot of attacks on Asian, Indian, Sikh people, they think it's because they're Muslim. Like, I don't think we can really get in the weeds, but, I don't think it's an accident that, right, the murder of MLK Jr. came at a time when he was really making connections about economic strife and the injustice of the war in Vietnam. So I think kind of having a broader view and having more ability to work together and have dialogues makes a huge difference. But psychologically, yeah, I think the first reaction is often defensiveness, going into our corners, retreating, but it's not very constructive.
All right, thank you. The second part of the question, I think you addressed. I'll read it to you. I think you gave a lot of good feedback right now. Relatedly, do you have thoughts about how to begin to approach the highly charged topic of minority on minority racism in our climate today? Thank you again for being here.
I think there are those who have specialized in a lot of this work even more than I have, right? And it is, again, like, how do we hold not invalidating the individual experience of someone who has experienced a terrible crime while still retaining the larger picture, ultimately. And I think the lack of interactions that we have has also played into this, the splitting, right? Like, a lot of my own growth, like I've told people, like, I get it. When I was a child or a teenager in Daly City, like, we were jumped by Black teenagers, and also as I've grown in my life, some of my closest accomplices, allies, friends are Black. Like, all these things are true, right? And we have extreme incompetence and exploitation even within our community. So being able to hold the nuances of that and speak to that, and it's not easy. My friend Dr. Kevin A. Dahl, for example, speaks very powerfully about anti-Blackness among Filipino communities and against that. And he gets a lot of pushback from the community who interprets that as, like, you're not standing up for our own community, right? And so the need for leadership that can actually speak out is huge, being able to have those dialogues and to share the information, because people don't actually hear about how have people work together, what are resources where people are working together, where to begin. There's a lot of rage and hurt and fear right now, which is understandable. And I think for a lot of us in certain positions, and I'm glad to see there's a policy person here, but it's about how do we not just be reactive. There is a place for grieving and mourning and community aid and mutual aid and support. But then instead of being reactive, what is resilience, right? How do we make a long-term improvement of the community instead of just sort of building the walls and not solving anything?
Okay. I'm reading one last question. We have about 5 minutes. It's a pretty personal, detailed question. It's a good question. I'm having feelings about it, but that's part of it. We can talk about this. I'm glad that she submitted it. Some of my family members, unfortunately, have racial bias against African Americans. My sister was recently robbed by an African American teenager in San Francisco. The family's anti-Black sentiment flared. Some of the recent attacks on Asian Americans in Oakland's Chinatown and San Francisco were also perpetrated by African American suspects now in custody. What is a good approach for talking about these incidents in a way that validates the family's experience, but without reinforcing racial bias?
Mm-hmm. I think there's a lot of complicated discussions about that. And kind of as I'd mentioned, right, it's really supporting them in their pain and their fear and their loss and addressing it. I think there's a lot of good writing about, for example, restorative justice that, it's more than I can get into, but how do we actually work on the foundational issues that bring us here, right? And humanizing each other is big. I actually briefly worked for community probation in Alameda County. And yeah, and the justice is not equal. And I don't think people understand sort of systemic reasons that people get put in these positions, right? And as someone had commented about, what about white perpetrators of anti-Asian hate crimes, or the family in Texas that the two little boys and their dad was slashed with a knife, that was from a Latino person. Ultimately, how much does that race matter, right? Or I actually got put in Facebook jail once for factually stating that, the most homicidal people in history have been, straight white men. And so again, putting context, right? How do we help a family grieve and give them support, but then also look at the larger pictures of how we get put in this place? I think a lot of the Black and Asian violence, it's not a coincidence. It happens to happen a lot in where people are extremely economically stressed, right? Chinatowns are not where rich Asians live, right? There's a reason there's so many poor elderly families there. And I do also really encourage and have called out or called in a lot of our wealthier AAPIs, especially in this area. There's a lot of great wealth, but none of it has really been directed at improving communities, or very little. And to really think about that, right? Like, what are the solutions and the empowerments that we can do? And addressing our own racism is difficult. It's ugly and painful work. I think we've all hopefully been doing a lot of that in attempts at improving DEI over this past year. But again, the parallel, whether it's systemic, community, in our own families, I've had plenty of painful conversations, or internally, like evolution and growth, even if it's very positive, tends to be super uncomfortable at the time, but it's still very much worth doing.
Thank you. I'm going to read these last two. We have 2 minutes left, this feedback. I appreciate you, Dr. Sue, for your ongoing work, leadership, and clinical wisdom for the AAPI community, plus more. Yes, so he left his name and email. I will send those to you. And then finally, I'm grateful for Dr. Sue giving this talk today. It's been a fascinating and additionally challenging year, 2020-21, in which to work with Asian patients and also to be an Asian provider, trainee, Asian person. I appreciate Dr. Sue's expertise in offering this context and education. Unfortunately, we just got 3 new messages, but we have 1 minute left, so we don't have time. Thank you, Helen. This was fantastic. Maybe you can come back again. You dropped a lot of knowledge on us today, and I really appreciate it.
Yes, thank you so much for being here, and really in-depth, thoughtful questions. I love it. And yes, I'll send the PowerPoints, and hope you look up some of the resources in the orgs.
Okay. All the final comments are, thank you. Thank you so much. All right. Take good care. Have a good day, everybody.
Bye.
Bye.